I'll start by saying the staffing shortage started well before the pandemic. That's the first thing to note. And obviously it has not gotten any better and has gotten worse during the pandemic. And that comes from things as simple as burnout and people changing their minds about what they want to do as a career. But also what we're facing now is an increasing number of team members who are exposed or who get sick and have to go out. And so we are working very closely with, following the CDC's updated guidelines to try to get people safely back to work as soon as possible. As far as creative solutions, I mean, float pools, on-call pools, contract labor, trying to help nurses out as far as taking some of the burden off of them by having, for example, pharmacy techs come to the floor to help with med passes. I mean, just all kinds of things we're thinking of. The short answer, the big problem, however, is that there just does not seem to be many new hires, relatively speaking, out there. And we are absolutely currently remain dependent on contract labor, as I'm sure most health systems are. But we're continuing to look for options every day.
Dr. O, anything else?
Yeah, so I think we've expanded. I think most of the creative solutions we've tried. I think that the solutions to this are more in the long-term realm, and right now, probably not helpful, but it doesn't mean we should start doing them. One is to start increasing the pipeline and the number of people going into the career in the field, and getting our young people excited about careers in healthcare and taking care of patients. And that, I think, over the long run is going to be big. The other one is restructuring how we provide medical care. There's a lot of insufficiencies in the way we've provided medical care. That's not a pandemic thing. That's been around for maybe decades. And changing the way things are approached and how patients interact and get into the healthcare system. And one of those is virtual. I think virtual medicine, you're going to be seeing a lot of that even when the pandemic's over. But these are all long-term solutions. And for now, it's relying on expensive contract care and float and travel nurses and asking people to extend their hours, work overtime. And we have to be careful because doing that will increase burnout. So it's a fine balancing act. And it's tough to be in hospital human resources right now.
Thank you both. Next, we'll go to Jenna.
Hi, kind of a similar question, but I know I talked with Chief Ziegler yesterday about, FEMA and state help coming in to help out with EMS. Is that an option for hospitals to get any state or national help in that capacity, kind of similar to what EMS is doing? And then also, I didn't know if you had a percentage or number of just how many employees you're kind of seeing weekly or daily having to be out because of COVID. Thank you.
And I just say we'll start with Dr. O and then Dr. Fuller, and if we'll just keep it really brief because we just have about 3 minutes left for the whole press conference.
Yeah, that's really not my purview. I'll pass it on to the Chief Ziegler.
Well, I think was the question about what the hospital staffing, if there could be federal support, was that the question,
Well, regarding hospital staffing, there are possibilities to do that. And just like as Joshua mentioned earlier on, we're reaching out to the state, which reaches out to the federal government to help with our testing resources, because really there's no two ways about it. We have to be able to increase access to testing, particularly for our marginalized populations. And so there are a lot of things going on right now to improve that. And I think within the next week, we'll see some of those implemented. Now, FEMA, which is the Emergency Management Administration, can release people to help out. So we saw that for with our health system with Wilkes Medical Center, where we had a FEMA site for monoclonal antibody administration. And so those discussions are taking place right now. But the problem is that almost every state east of the Mississippi right now is in the same boat we are. And there's only so many resources to go around for so many areas. So, but I can assure you, we are trying our best to grab those resources and bring them to the triad.
Dr. Fuller, any comments?
We've had very preliminary conversations, I think, as far as that type of assistance. Nothing in the works right now as far as, helping to set up testing sites, et cetera. I mean, nothing is solidified at this point. And I'm sorry, Jen, I forgot the second part of your question.
It's okay. I just didn't know if you had a percentage or idea of how
Oh.
many employees were actually getting sick with COVID and having to be out.
I don't have that percentage. It's increasing anecdotally by day, I can say with certainty.
Yeah, I won't, people we already know, I'm not one to spout out numbers because you got to take it into context. But what I will say is I did some rough calculations yesterday based on our numbers in the triad and then estimating how much underreporting there is and what our populations are. So roughly about 5% of Forsyth County right now, maybe even a little bit more, has COVID today. And that's a lot of people with colds and flus. And so if you extend out that to the hospital employee base, I bet you the numbers are about the same.
I would add to that, Dr. O. I mean, we have people with at-home tests that that's not required to be reported. So, yeah, that number is the 939 we reported yesterday is probably very low. So our last question, and thank you all for being on here. I'll go to Wes Young, Winston-Salem Journal.
Yeah, I'm just curious if you guys, I don't know who wants to tackle it, but if I'm thinking, well, maybe I should get a COVID test, I can run down to the drugstore and get one of these sort of instant over-the-counter 10-minute tests, or I might have to do something different. Can y'all give advice and guidance on what kind of tests and under what circumstance you recommend people to do?
Sure. Well, first of all, why don't you run down to the drugstore and let me know if you can find that test? And then if you can, let me know which drugstore it is. Because the over-the-counter tests right now are really tough to find. Now, I did see something in the national media today that DHHS at the federal level and the U.S. Postal Service are starting to work out the details for actually mailing out home tests. And presumably that'll be to the most hard-hit areas first. So I would think would be one of those. So you might get one in the mail, but if you're waiting on the mailman, you know how that goes. So once the tests start to become more available again, for most of your home family decisions and things, and whether or not you need to sit out for 5 days before going back to work, I think the home tests are good enough for that. So when the CVS starts to get them again or Amazon, you can use those. And I think that's good enough. But you just have to, follow through on the test result and do what the test says. So if it's positive, it's time to start doing a jigsaw puzzle for 5 days during these cold January days. If you have serious underlying health problems and you have cold and flu season or symptoms, you're probably going to want to get a medical grade test to back up the test. So if you do a home test first and it's positive, you'll probably want to call your doctor and say, hey, I had a home test and it's positive. If you're older, have a lot of underlying medical problems, immunocompromised, so on and so forth. Because a lot of times we back those up. Certainly for anyone who might require admission to the hospital, we use medical grade testing for that.
I'll just say, from my perspective, you know, a positive home test in a symptomatic patient, that works, right? I mean, that's pretty straightforward, but asymptomatic people who might be using a home test to rule out COVID, you know, that's where it gets a little trickier, and they're not as good in asymptomatic, for example, asymptomatic exposures, for example. So you just have to kind of, you know, take it all into consideration as far as whether you have symptoms or not, what kind of tests you're using, et cetera. Consult with your physician. And I absolutely agree with the recommendations from Dr. Ohl.
All right. Well, thank you all. Thank you everyone for being on the call. And I think just to wrap it up, obviously, we all know there's challenges with testing, but you know, the two big things is don't go to the emergency room for a test. And also, you know, negative tests are not required to return to work. We're seeing that with some employers. That was some guidance early on. We know that some more resources are coming to the area. We know that in Greensboro, there'll be the Coliseum, a mass testing site will be opening up soon. The health department is working with the state testing vendor to open up other options in the community. We know that both hospital systems have testing, mass testing, or working on further increasing that capacity. And then, as Dr. Ohl and Dr. Fuller have said, you know, obviously there's the at-home options, but you know, now I would say that you could presume if you have symptoms of COVID, which are similar to cold and flu, that you can almost presume that you are positive. With that, I will thank you again, Dr. Fuller with Novant Health. Thank you, Dr. Ohl with Wake Forest, Atrium Health, Wake Forest Baptist. And thank you, Director Ziegler with Emergency Services. I appreciate everyone being on the call today, and please stay safe and have a great weekend. Thank you.
Thanks a lot.